Hello everybody. All right, we're on to week 6. This week we're going to be discussing congenital diseases and disorders. Okay, congenital abnormalities, also known as birth defects. So birth defects are caused by genes or teratogens, where a teratogen is a chemical substance that causes damage and malformation to an embryo during the pregnancy. Most common teratogens are infectious diseases, physical agents such as radiation, medical drugs, chemicals, and also like maternal issues such as diabetes. The image below is a fine example of the effects of a teratogen that can have on the development of an embryo. So in the 1950s and 1960s, there was the sleeping aid, let's see if I can pronounce this, thalidomide, that would be prescribed to pregnant women that caused a condition offensively known as flipper baby syndrome. The exposure to the drug resulted in the shortening or altogether absence of the limbs. The side effect of the drug, such as these, stemmed the movement that created the FDA. The link provided here is a great article if you are interested in reading more on the topic. All right, to beat the dead horse here, which term refers to a substance that causes birth defects? Teratogen. Seeing questions like this pop up, it would behoove you to know the other terms that I didn't ask during the lecture. All right, let's see. All right, let's start with the heart. Acyanotic defect. Cyano, this is going to be a medical clue term for blue, hence the blue text to help you remember. Cyano, or A, is anti-blue. Acyanotic defects is distinguished by no mixing of poorly oxygenated blood with blood re-entering the system circulation, which then means that they do not normally interfere with the oxygen or blood reaching the body's tissue. So there's a defect, but your body's not turning blue yet, so it's acyanotic. Here's a few lists. VSD, or ventricular septal defect, is quite common. It's the abnormal opening between the walls shared by the right and left ventricle, which are two of the heart's chambers. ASD is atrial septal defect. It is the opening between the right and left atria that causes abnormal blood flow throughout the heart. And then there's correctation, which is the narrowing of the area of the aorta. This causes increased blood pressure above the narrowing and lower below it. PDA, patent ductus arteriosus, is often seen in premature babies. This is where there's a hole in the heart that is present during fetal development, but does not close entirely because of the premature birth. The video link here, take the time to watch this now. It's a visual aid that will help you to picture the above listed conditions. All right, more blue. This is the cyanotic defects, which means that the poorly oxygenated blood is mixing with the blood re-entering the circulation system. This is different from the acyanotic, where there is no mixing. This causes cyanosis. This is where the skin and mucous membranes, like inside of your mouth, is actually turning a bluish tint. The condition involves tetralogy of Fallot, which tetra, meaning 4, is a combination of 4 heart conditions: pulmonary valve stenosis, ventricular septal defect, overriding aorta, and then you have right ventricular hypertrophy. Cyanotic defect can also occur with transposition, which is the reverse of the great arteries, and then there is a tricuspid atresia. The tricuspid valve is between the right atrium and the ventricle, and this condition is where the valve does not develop. All right, circulatory system diseases include sickle cell anemia. This is caused by an abnormal form of hemoglobin called hemoglobin S within the red blood cell and is synthesized by an individual who inherits homozygous, or having identical alleles, of hemoglobin S genes. The red blood cells in a patient suffering from sickle cell anemia have a sickle shape to it. The name tells it all. So the images that I provided here are a great example. Because the shape issue caused by the homozygous hemoglobin S genes, the patient's circulation becomes impaired, thus causing blood vessel damage. And if there's blood vessel damage, the damage is going to bring about chronic organ damage and pain. All right, follow the red arrow. The red arrow on this slide is to help you better understand the location on the spine when I'm talking about nervous system diseases and disorders. So neural tube diseases is what I want to touch base on. A neural tube defect occurs in the first month of pregnancy due to a failure of the neural tube to close. Spina bifida occurs when there is an incomplete closure of one or more vertebrae with no protrusion of the spinal cord or membranes covering the brain and spinal cord, known as the meninges. It is as if someone forgot to close a window, but nothing is falling out. A bit worse now, following the arrow down, following the arrow of severity, we're going to get to meningocele. This is the incomplete closure of the vertebrae accompanied by protrusion of the spinal fluid and meninges into an external sac. And this sac is visible. So it's like the window is open and the curtains are blowing outside the window now. The third condition is called myelomeningocele. Remember, myelo is that medical prefix clue regarding nerves, and then the meninge, which is like the meninge, which relates to the meninges being affected. So the external sac on this condition contains meninges, spinal fluid, and a portion of the spinal cord or nerve roots. So if we're going to be following up using this window analogy, the window was left open, the curtains were blown out, and now the blinds are hanging out. All right, here's a slide that kind of depicts the above listed conditions that I was talking about. So if you were to have the red arrow here, it would move left to right. We start with our normal developed spine and then move to the right to see spina bifida where the window is open, and then move to meningocele and then the myelomeningocele. With each worsening condition, that visual bulge is going to be on the infant's backside and it can be seen. All right, moving on. Our next nervous system disease we're going to be discussing is hydro or water cephalus. This is where there's too much cerebral spinal fluid on the brain ventricles. It's poorly referred to as water on the brain. So hydrocephalus results in the infant's fontanelle, or that soft spot on the skull, and it'll cause it to bulge. Hydrocephalus results in the infant's fontanelle. Is a congenital. It happens before the cranial structures have fused. If it's acquired hydrocephalus, this develops at birth or any time after and is usually caused by injury, unfortunately, like shaken baby syndrome. Some diseases can really contribute to this as well. Non-communicating acquired hydrocephalus happens if there is an obstruction to the spinal fluid flow. Communicating acquired hydrocephalus arises if the problem is due to a faulty absorption of the spinal fluid. Cerebral palsy. This is a permanent bilateral non-progressive paralysis. 70 to 80% of incidences occur prior to birth. Causes of cerebral palsy include maternal rubella, which is why it was important to have a vaccine. Maternal diabetes, anoxia, A for anti, ox for oxygen. So anoxia is the absence of oxygen, which could occur if the embryo's umbilical cord gets wrapped around the neck, or there's also other scenarios. Also toxemia, where poisonous toxins are found in the blood. You also have preeclampsia. This can be a contributing factor. This is where the mother has pregnancy-induced hypertension, aka hypertension is high blood pressure. And then cerebral palsy results in developmental defects of the infant's brain. There's also trauma-induced palsy that can occur during or after the birthing process. Two forms of that cerebral palsy are spastic, which is increased muscle tone, and arthroid, which involved involuntary movement. Digestive system diseases and disorders now. So we'll start at the top and work our way down. The cleft lip and palate. This is a defective closure of the soft and hard palate in the face, so that the roof of your mouth is that palate area. Then you have the tracheoesophageal fistula. Fistula is a hole, is an abnormal connection between the esophagus and trachea. We have esophageal artesia, is where the esophagus is not completely formed. And then there is the pyloric stenosis. This is the narrowing of the pylorus or the pyloric sphincter located at the lower portion of your stomach. That portion leads to the upper part of your small intestine or duodenum. To detect this, the lab can have tests run that look for marked dehydration and electrolyte imbalances. All of the above listed conditions affect eating and nutrition absorption, starting with the mouth all the way down to the stomach. All right, moving past the stomach, digestive issues can include like a malrotation with the volvulus, which is where there is a malformation of intestines during the 10th week of pregnancy, which is the first trimester. Hirschsprung's disease is the obstruction and dilation of the colon with feces. This is why newborns must poop before they are allowed to go home. That first bowel movement is known as the meconium and it usually passes within 48 hours of birth. Let's see here. Omophallocele occurs when intestines or other organs poke through the navel when the abdominal wall fails to close. Genitourinary system diseases deal with the genitals and urinary systems. So we have cryptorchidism, and this is where the testes do not descend into the scrotum from the abdominal pelvic cavity. The test associated with this one has a telltale name called gonadotrophin test. Defects of the ureter, bladder, and urethra can come with a slew of disorders. You can have duplicated retrocaval or ectopic orifice of the ureter, ureter exstrophy of the bladder, congenital bladder diverticulum, hypospadias and epispadias. Look to your text for a little bit more in-depth description of that. We'll go over the urinary system later in our lectures here. All right, musculoskeletal system diseases and disorders. Clubfoot. This is a congenital deformity in which the foot is bent inward, or talus varus, outward, valgus, equinus, which would be downward, or then you have upward, which is calcaneus. A lot of it's related, those words are related to the foot anatomy. Hip dysplasia is when there is an abnormality of the hip joint, and then you have the Duchenne muscular dystrophy. This is the progressive bilateral wasting of the skeletal muscles. Lab tests can help in diagnosis. It would be like a urine creatinine and serum levels for CPK, which is a creatinine phosphokinase, and transminase. These enzyme levels, which elevate during muscle wasting. Okay, now for some metabolic disorders. We'll start with cystic fibrosis. This is an exocrine gland disorder. This is where copious amounts of mucus clog the bronchi, lungs, and also involve the pancreas. And when I say copious, I'm talking an unbelievable amount of mucus to the point where valves and ports are placed in the patient's lungs to drain the mucus because the body is generating so much. 2 positive sweat tests, and one of the following condition aids in the diagnosis of cystic fibrosis. There could be obstructive pulmonary disease, there could be confirmed pancreatic insufficiency or failure to thrive, also family history of cystic fibrosis. Due to the familial links, DNA testing can be used to diagnose prenatally, i.e. in the womb. Another metabolic disorder is PKU, or phenylketonuria, is involved. PKU is an inherited error in the phenylalanine metabolism. The enzyme phenylalanine hydroxylase converts the amino acid phenylalanine into tyrosine. If phenylalanine accumulates in the blood and urine due to the deficiency of the enzyme, it becomes toxic to the brain. Blood tests mark that phenylalanine level with either heel sticks in infants or urine phenylpyruvic acid level performed within 24 or 48 hours after receiving dietary protein. So pretty much the patients can prevent problems from avoiding foods that contain that strain in their protein. So take time now to watch this video via the link to get an idea how people can live with PKU from a patient's perspective. Okay, our last topic on congenital disease and disorders are going to be syndromes. Down syndrome, also known as trisomy 21, is where the patient has received an extra chromosome 21. Chromosomes should come in pairs only, but with trisomy 21, there's 3. This is one of the most common causes of congenital abnormalities. Blood tests for the chromosomal genetic markers for the fetus can be tested if they are circulating in the maternal blood at the time of pregnancy. Fetal alcohol syndrome is another. It's a physical, mental, behavioral causing problem due to consumption of alcohol by the mother during pregnancy. So this one's preventable. And then there's Tourette's. This is a nervous system disorder where the affected individual makes involuntary repeated tics and sounds or movements. Hollywood has a tendency to portray foul-mouthed men who suffer from Tourette's with cursing. However, this is not necessarily always the case. Okay, last slide, everyone. We're up to quiz 4 now. Congratulations. Here are some highlights to help focus your studies. Also, for your response post assignments, there is a new link to utilize and cite. This is the National Institute for Cancer. You might be becoming familiar with this topic, so any questions, please feel free to reach out. Our lectures are going to get significantly longer coming here in the future because we're going to be covering multiple chapters, multiple topics, so get comfortable next time. And if, again, any questions, reach out and feel free to contact me. Thanks.